First of all, it's really important when we are investigating what's going on with someone with fecal incontinence as to what type of stool they're forming or what their poo literally looks like. And so we have this very common scale. It's called the Bristol Stool Form Scale. And when we pull this out in our clinic, sometimes we do get rather odd-looking expressions coming back to us, but because we do want people to know exactly what is normal for them. And so, as you can see here on the screen, there's 7 different types, ranging from type 1, which is when someone may be forming hard lumps and it's really quite a constipated, difficult expulsion of their faeces, all the way down to type 7, which is sort of runny and watery and not really controllable. With type 4, that more sausage-like shape in the middle being what we're after. So fecal incontinence is actually the loss or involuntary loss of any stool or even slight leakage during, or wind actually, from the anal sphincter, which the person has no control over. So they have this maybe a very short window of urge, similar to bladder urgency, where they literally have no time to make it to the toilet. And this can be from a very just small loss, like sometimes we call it soiling, to a whole complete fecal matter loss of any of those types there. And this is extremely embarrassing. You've also got odours to deal with, and not even the pads that they have for fecal incontinence are typically easy to be found either. And don't know about you, Sharon, but the pads are not always that sufficient at coping with
Absolutely
these.
not.
Yeah.
Especially if you've got like a type 7 sort of stool.
Yeah.
You know, it would be okay if it was kind of leaking out gently, but more often than not, it's not.
Yeah. So there's lots of reasons why this occurs, and for the number one reason potentially is that there's just weakness in the pelvic floor, and this is often from people who have been constipated and have been straining for long periods of time, and that tends to then make the valve of the pelvic floor, the anal sphincter, just lose its strength and elasticity. So this long-term straining can be a problem. Even medications sometimes can cause these sorts of issues. And then, of course, just gastrointestinal sickness, like, getting diarrhea that, is ongoing, really might need someone to help out with restoring the bowel health with probiotics and things like that. There's also, particularly for men in the workplace, lots of heavy lifting and loads that, potentially could be done with 2 people instead of 1. We also know that just ageing itself causes the back passage and the whole pelvic floor to get a little bit weaker. Then there's, of course, things like bowel disease, such as Crohn's and celiac disease, which cause inflammation in the bowel, and that can lead to people having irregularity in their stool and incontinence. We also see neurological conditions sometimes, like cerebral palsy in younger people, young males, and multiple sclerosis and Parkinson's disease. We actually know across the population that 1.34 million males, including boys, are dealing with incontinence in Australia. So that's 1 in 9 males. So it's not just a small problem. Although 80% of incontinence issues are reported by females, we actually also feel it's probably underreported in guys because, traditionally males have been a bit more reluctant to seek help for these sorts of things, including I've just had one patient this afternoon who waited 52 years to come and see me for a what we call post-void dribbling problem, and it's been embarrassing him for all of his life. He's now 60. So fecal incontinence is certainly a difficult one, not often talked about, but pelvic floor training is a really first stop shop for assisting. And Sharon and we also work in populations that have radiation therapy, and that's a problem I haven't mentioned yet, but men who undergo prostate cancer treatment may originally have surgery and then require follow-up radiation at some stage, or they might have radiation initially. So as time goes by, they can develop fecal incontinence, and often they're not expecting that because it happens 5+ years behind their treatment. So Sharon and I'll be talking about that a little bit more.